welcome to a very special discussion on how obesity affects heart failure. I'm 𝗗𝗶𝘀𝗰𝗹𝗶𝗺𝗃. World Health Organization, the WHO, estimates that since 1975, obesity levels worldwide have almost tripled, and India is no exception. Obesity puts extra stress on the proper functioning of the heart. And in today's discussion, we are going to discuss how do we maintain our heart health with extra weight and why losing weight is important for keeping good levels of heart health. I have a very illustrious panel of doctors with me today to discuss this very important subject. I'd like to welcome all our three panelists. I have with me Dr. Nityanand Tripathi, Senior Director and HOD, Cardiology and Electrophysiology at the Fortis Hospital, Shalimar Bagh, New Delhi. Welcome to the show, sir. Dr. Rushikesh Sambhaji Patil, Consultant Interventional Cardiology at Dr. L.H. Hiranandani Hospital, Powai, Mumbai. I also welcome you, sir, and Dr. S. Nagendra Boopathy, Professor of Cardiology, Senior Consultant Interventional Cardiologist at Sri Ramachandra Institute of Higher Education and Research, Chennai. You're also welcome to the show, sir. We're really glad to have you all amongst us for this very important subject. So I'd like to start with Dr. Tripathi. How do we define obesity? What is obesity and how do we measure it?
Hello. Obesity is defined as a condition wherein extra fat is deposited in our body, and it is deposited to such an extent that it becomes burden rather than it's an asset. If fat is in a small amount, it is an asset because it provides the energy during our starvation or like not taking food for some time or extended period of time. And as you said, the prevalence has increased significantly over a period of time. And to measure how whether you are obese or not obese, we usually use the BMI. BMI, if it is less than 18.5 kg per meter square, it is underweight. The normal weight is 18.5 to 22.9 kg per meter square. If BMI is there, then that is normal. Overweight, if it is more than 23 kg per meter square, and obese if it is more than 25 kg per meter square. So for our common public, if you are your BMI is less than 18.5 kg per meter square, you need to gain the weight. You are unhealthy. But if your BMI is more than 25, you need to really act on it. You are obese.
Right.
Why BMI? BMI is important because the weight differs as per height. So we need to adjust the weight as per height, and we cannot recommend a common weight for every height person. So we divide the weight by the body surface area, and whatever comes it is known as BMI.
Right. I'd like to go to Dr. Patil now. Dr. Patil, since obesity has become so common, but what are the factors that are increasing the prevalence of obesity in India?
Right. So hi, Richa. So you can see the obesity is one of the major risk factors for many diseases. Wellbeing says the obesity happens because over a period of time, we try to consume more calories than the body needs. You will see for the daily routine activities of the bodies like breathing, walking, doing any activities warrant some calories. These calories, we get it from the food. These food calories we store in either in terms of glycogen or the fat. Now, this storage is for the immediate requirement and also for the future requirement. Now, when the calorie intake is more than this calorie utilization over a period of time, these excess calories are stored in the body more as a fat. And this imbalance, what we call the energy imbalance, leads to the more weight accumulation in the body. So obesity is not only because how much you eat it, but also the quality of food that we eat it. Not only that, our physical exercises, our stress, and inadequate sleeps are the common causes which leads to the obesity.
Dr. Boopathy, I'd like to understand what raises the risk of being obese.
Hi, Risha. Thank you for this question. Obesity, as it was clearly mentioned, it's a balance between calorie input and calorie output. If you take too much amount of calories that is not needed by your body, you will of course become obese. So increased intake of food is the most important reason that causes obesity. So how can we increase the output? That means if you don't do any proper exercise, that means you are not doing any kind of exercise that is recommended by WHO, that is 150 minutes aerobic exercise or a good amount of 90 minutes of vigorous exercise in a week, that means chances for you to become obese is higher, number one. The second one is eating behaviors. If you don't take healthy foods, like if you don't take good amount of vegetables, good amount of fruits, if you take significant amount of junk foods in your daily intake, that means you will be having a higher chance to have become an obese. In general, it's recommended to have 1 gram per kg per ideal body weight for protein for an individual. Most of our Indians do not consume good amount of protein. We in turn our food into carbs and fats, which are not good for our body. As such, carbs are the most important food what we consume in our Indian kind of food that leads to obesity. Other than this, significant amount of stress, either in personal life or professional life, will lead to obesity. Stress leads to increased secretion of steroid hormones, the stress-related hormones that will lead to obesity. And many individuals might be on some pills like steroids or OCPs that can also give rise to obesity. In addition, if you don't sleep properly, a good sleep by means 7 hours of sleep is essential for us to have a healthy life. If you don't sleep properly, that means you are sleeping only for 3 hours, 9, you are sleeping for 7 hours, but they are not continuous. You are sleeping for 7 hours, but during daytime, you don't follow a specific pattern. That means you are having a sleep which is less than 7 hours. The ideal sleep is going to be between 7 to 8 hours. A sleep less than 7 hours, an interrupted sleep, will lead to stress. And similarly, if you kind of do exercise inadequately, that again leads to obesity. And your environment matters actually. If there is in general social relations, like if you don't have a good park in environment where we can go for walking, jogging, and if you don't have good peers who can support you in kind of maintaining your weight or losing your weight, then that again can be a risk factor. And genetics plays a significant factor in obesity. The reason advances says that microguts organisms in the gut can also play a role in obesity. These are all the various reasons why an individual can become obese. Whenever there is going to be intake of more than 7,500 calories for an average body weight individual, there's a chance that you will gain 1 kg of weight after that. So if you lose 7,500 kilocalories, then you may lose a 1 kg weight. If your input says more than 7,500 kilocalories, then you may gain 1 kg of weight.
Right. Thanks for that insight, Doctor. Dr. Tripathi, if somebody is obese, what tips would you like to give them for managing weight?
See, it's very important that he should be motivated and should set a goal. Unless a person set a goal and motivated, he's not going to achieve weight reduction or for that matter, anything. So we need to set a goal and the person need to like feel that he is obese. And for that, he need to weigh himself daily by setting a goal so that he can come down to or normal weight. You can use a phone app. There are many apps which are available and can be downloaded in phone who records daily calorie intake as said by Dr. Boopathy. It is important that if we increase our calorie intake, then we are going to gain the weight. So it is important to record the food habit, record the daily calorie intake, and record and take a tab of it so that a person can consciously decrease the calorie intakes so that he can improve the weight and can meet a goal. A specific goal should be set by the person, and while setting the goal, it should be achievable. It should not be exaggerated. If you set a goal which is exaggerated, which is not achievable, not doable, then each time you fail, you get like demotivated. So keep yourself motivated, keep a small goal, and if we take a small step, we can cover the miles of our journey. So that is the most important thing. The second is go for a regular exercise. Apart from the food habits, regular exercise is most important. Regular exercise do burn the calorie in the body, and then it also keeps you healthy. Take a lot of water intake if you are healthy, and the identify your temptation. What makes you to eat more? And if you have identified your temptation, then try to stop it. Try to do something else when temptation comes to your mind. And then if plan your regular physical activity, as I told you, and keep a tab of it so that you can regularly go for it, and you can increase your activity gradually and daily. So aerobic exercises like jogging, biking, swimming, they are important. Weight training should be done, but it should not be strenuously done because it is going to increase your the blood pressure as well. So these are some tips that are helpful in reducing the weight.
Right. Thank you so much, Doctor. Dr. Patil, now I would like to put the focus on the relationship between obesity and heart. So how does obesity lead to heart failure?
Right. So I think that's a very important question. So first, when we say heart failure, so what exactly the heart failure is? So the heart failure means it is the inability of the heart to pump the sufficient blood as per the requirement of the body. Now you will see the diabetes and blood pressure, these are the one of the major risk factor for this heart failure. But let me tell you, the obesity and obesity related factors contributes quite significantly. If you'll see the statistic wise, almost 11% of men, they have a heart failure related to the obesity or related factors. And the women, this incidence is almost 14%. So why it is so? So when we say the obesity, it leads to the structural and the functional changes in the heart. So what exactly the functional changes? So there is a hemodynamic changes. So when the body weight is more, the body volume is more. The heart has to work more to pump that amount of blood. When heart has to work more, there are more muscles which are at the stress at any given time. Whenever more the stress in the heart muscle, there are times more wear and tear is happening. There's more fibrosis happening. This is leading to more structural changes in the heart, which reduces the compliance of the heart. So what exactly the compliance? The heart's inability to take or the ability to take the blood and the pump becomes less. So as the compliance reduces, the water start accumulating in the body, the overall function of the heart reduces. So that is one of the major things where it causes structural and functional changes in the heart. Not only that, whenever we say the heart, there are always some, we say the blood supply to the heart, that is the coronary artery systems are there. It get affected in the obesity because of associated cholesterol deposition. They have associated lipid deposits. They have an endothelial dysfunction. That means the inside vessel lining of these vessels are not proper. It is more, we say old, and it get cholesterol deposits very well. So associated coronary artery disease makes the heart, further blood reduction is less and the heart function becomes less. Now, this plumbing system, if you'll ask me, also there is a problem in the wiring system of the heart. That is the conduction system in the heart start developing up, where the heart functions as well as heart rhythm becomes erratic. These irregular beats in addition to lead to the heart function. Now, over and above, you will see the obesity leads to the associated respiratory function problems, leading to more sleep apnea, leading to more hypoxia. That leads more vasoconstrictions, like it constricts the vessel. So it increases the afterload of the heart. So heart has to work even more than usual. And this all leads to the inability of heart to pump the sufficient blood, leading to the heart failure instances.
You've put a good deal of light here on how obesity affects heart. I will now go to Dr. Boopathy. Dr. Boopathy, in your opinion, what other heart conditions have you noticed where people are obese?
Obesity is associated with heart failure clearly, as clearly mentioned by the previous speaker, Dr. Rushikesh. In addition to heart failure, obesity has a direct link with hypertension. As the patient becomes obese, they may develop sleep apnea, which can increase the pressure inside the lung, and they can develop pulmonary artery hypertension. And because of hypertension, obesity directly links to hypertension, they can develop all hypertension related side effects that includes coronary artery disease, stroke, myocardial infarctions. And in addition, it also has a significant impact on fertility of females, especially a disease called as PCOD. By increasing insulin resistance, it has a significant impact on fertility of patients. Prolonged hypertension can also give rise to diseases of aorta called as aortic aneurysm or some other aortic diseases also. It is not a benign disease. We need to check the weight and keep it under control.
Right. Dr. Tripathi, what are the symptoms and signs of a heart failure?
See, if a person has a dry and hacking cough, that can be a starting of the heart failure, accumulation of the small amount of the fluid in the lungs that lead to hacking cough or dry cough. It becomes more when patient reclines or lie down, goes for a sleep. Or it may happen that if patient goes to the sleep, he's in sleep for 3-4 hours, but he starts coughing, wake up, sit down, take some like uh, sit for 30 minutes or 40 minutes, take around the house, and he becomes all right. This is known as paroxysmal nocturnal dyspnea, and this might be the first symptom in the heart failure. The second is worsening of the shortness of breath. Like the person who was able to do a routine activity previously is finding it hard to do the same level of activity now. So if there is a change in shortness of breath in level of activity, then a person should contact the medical person as soon as possible. So if there is swelling in the lower part of the body, that is dependent part, like ankle, or if there is an increase in the weight, that we emphasize to regularly monitor the weight. And if there is a significant increase in the weight, then one should contact the medical system so that we can diagnose what is there. If there is a discomfort in the chest, or if the person has trouble in sleeping, like he is not able to lie down, he has to regularly sit up or has to elevate his head while lying down, then he should contact the medical facility as soon as possible. If these symptoms becomes aggravated, that cough is dry, hacking, and it's troublesome, this is alarming symptom. Some of the alarming symptoms that I will illustrate is shortness of breath at rest, or even going to the toilet, or going to the like brushing, or doing a routine activity. If a person becomes short of breath, he should immediately contact the medical system. Increase discomfort or swelling in the lower part of the body, and sudden increase in the weight. If the weight has suddenly increased in last 3-4 days or a week, that is the rapid accumulation of fluid is inside the body, and should immediately contact the medical system. And then the new or worsening dizziness, like giddiness, dizziness, or not maintaining your balance, that is also can be one of the sign. Loss of appetite and increase in like a person is not going to sleep, and as soon as he lie down, he become breathless. These are the patients who require an immediate attention. These are some of the common symptoms that are for this CHF.
Very well explained, sir. Thank you so much. I'd like to go to Dr. Patil. Dr. Patil, how can we do lifestyle changes that can help reduce the risk of obesity-related heart failures?
Right. So you can see the small changes can make a big difference. I always tell this patient. So what all things they can do? So all those patients who have obesity or heart failure, how we approach them, we always tell them to monitor their body weight daily basis. It serves many purposes. So they understand if they're gaining the weight. So they becomes quite conscious in the early phases if I have to do any changes in their food and exercise to control their weight. Not only that, whenever there's a sudden rise in weight gain, as even the previous speaker was saying, whenever there's a heart failure, there is a water accumulation in the body, you can see there's a swelling on the leg, and we can pick up these early signs. So when there is a rapid rise in weight gain, we say almost 1 or 2 kgs over days of 1 or 2 days, these are the signs where there is an impending heart failures are there, where we can titrate certain medications, we can implement certain therapies, where we can reduce the hospitalization rate as well. So monitoring weight will help us to whether we are gaining the weight rapidly or shortly based upon certain changes, either in terms of medication or in terms of our diet and exercise helps us to know. Over and above, quitting the smoking. So smoking is one of the notorious things. It leads to n number of health issues, and even the heart doesn't get spared from that. The smoking causes more increase in your heart rate, your blood pressure. It replaces your body oxygen with carbon monoxide, where heart has to work more. So it effectively leads to the heart failure. So quitting smoking is first and foremost in all those patients who are smoker and the heart failure. Not only that, being physically active is always we say in all those patients who are obese as well as heart failure. So physically active, we never say this patient to go to the gym. Any activity which makes the body to move, simple walking, jogging, climbing stairs, swimming, all those forms of activities. The amount of activity is based upon the patient body status as well as their heart function. So I will suggest to consult a doctor before you go for any high intensity exercise. But yes, the physical activity helps on these patients. Not only that, getting enough rest, as even the previous speakers were saying, that at least 7 hours of sleep helps for body to relax, the heart to rest. This rest helps for the heart for better functions on the long-term basis. Most important, the managing the stress. So stress always leads increased heart rates, increase pulse pressures, increase pressure on the heart, the BP rises. So managing stress is also the need of time, where simple resting, meditations, yoga do help for this patient. Other than that, we tell them to be compliant with their medicines, and we say the certain food like junk foods and all, we tell them to avoid it and keep a regular checkups. Get your numbers checked, like what is your blood pressure, what are your sugars, whether blood pressure is under control or no. If it is uncontrolled, try to get those factors under check. Check your cholesterol, do regular health checkups. I think this lifestyle will definitely change the life of a patient.
Right, sir. Thank you so much. Lastly, Dr. Boopathy, we talked about managing stress. What about managing diet? What role does diet play in managing or reducing obesity and related heart issues?
Actually, that's a very important question. Diet plays an important role in not only in obesity, but in all cardiovascular diseases. That includes MI, stroke, peripheral artery disease. It's quite simple concept. You should know how exactly your weight should have been. Okay, according to your sex and age, there's a data available. You can identify the exact weight what you should have been. And if you know the weight that you are in appropriate range, everything has got a range. There's no single number, appropriate range. Then you should understand how much amount of calorie you should take. If you are then start looking at the food what you eat. There's multiple apps. Digital health is so robust now. Multiple apps available with which you can enter those food what you are taking, and the app will tell amount of calories what you are consuming. If you do it for a couple of days, you will come to know on an average calorie intake what is you are consuming. And if you think that you are consuming too much of calories than what exactly you should have been, ultimately you will develop obesity. That's for sure. And if you are in a mood to lose weight, it's quite simple. You decrease your calories and increase your physical activity, and change your diet to an appropriate diet. So decrease your calories by going to digital health. Enter all the calories for all the foods what you are taking in, and the app will tell the amount of calories consumed by you. You know how much amount of calories you should consume from the available chart. And then next thing, physical activity. Physical activity is very clearly told before also. You have to do 150 minutes of active exercise, or kind of 75 to 90 minutes of vigorous exercise to lose some calories. In addition, you can select your foods, change your food pattern, take a lot of protein. Most of us don't take 1 gram per kg of ideal body weight protein in our Indian food. So you have to change your carb-based food and fat-based food into protein-based food, and take a lot of whole grains, a lot of natural vegetables, a lot of fruits. Consuming such a healthy diet that is rich in whole grains, proteinaceous food, and with rich in vegetables and fruits will definitely decrease your chance to become obese for sure. And they have got a lot of antioxidants. They will prevent some of the inflammatory associated diseases also.
Right. I think that's really well said. Thank you so much, doctors, for sparing your precious time and being part of this awareness drive with us. I hope that this discussion has put a good deal of light on how to reduce our obesity-related heart issues, and it's been an eye-opening discussion indeed. Thank you so much once again for being with us.
Thank you, ma'am. Thank you, everyone.
Thank you.